Welcome back. In Australia, nearly two-thirds of people diagnosed with dementia are women, a trend which many researchers had linked to longer lifespans and genetics.
But now there's a study that has identified a new risk factor that could influence the development of dementia, and that is menopause. Now, for more on this, we're joined by Dr. Helena, live from the GC. Helena, great to see you on this. So talk us through this research and what it has discovered.
Well, we've actually found that there are as many changes in a woman's brain as in her ovaries during menopause. However, menopause alone isn't enough to cause cognitive decline or Alzheimer's disease or any other dementia. It just makes a woman's brain more susceptible to the damaging effects of toxins like smoking, alcohol, air pollution, bushfires. It makes a woman's brain, less resilient to sleep deprivation, which is when the brain detoxifies. The harmful effects of sugar, especially in the form of soft drinks, fruit juices, refined starches, stress of any sort, a sick family member, a hostile workplace, marital discord, all these things now, she's not as well able to protect herself and stand up to those things as much as she used to. However, with most women, they do bounce back. So it is a temporary brain adjustment to so many changes happening in the brain.
Right, okay. So is there a connection here with the decline of estrogen levels that happens during menopause and the link to dementia?
Yes, definitely. There's drop in not only estrogen but also progesterone hormones, and these two hormones are defined as neuroprotective because they actually do help clear toxins from the brain, reduce inflammation, help in the production of anti-inflammatory molecules, brain growth factors, and these two hormones help the brain use glucose for fuel. So when these things decline, that brain is more sensitive and we need to pay more attention. It's a wake-up call for a woman. Finally put your own needs up there as a priority. We need to have good, real, whole food. We need to get adequate exercise. We need to get fresh air. We need to have more joy and laughter in our lives because that is actually protective to our brain as well. And there's also changes in size and structure and connections in our brain that regulate, thinking and metabolism, and temperature regulation. And this is why sometimes women get hot flushes and also why women start to feel a bit less competent because the brain regions responsible for planning and decision making and memory are all compromised for that period of time.
Is there any risk then if women out there are using or going to use HRT for menopause, which is, can be prescribed through a doctor and worked with through a GP, is that going to help these symptoms, obviously, but will that help, I guess, try and stave off any risk of dementia?
It can. It really depends. Timing is absolutely critical.
Right.
If you have a surgical menopause, an artificial menopause by having a hysterectomy, having your ovaries out, then the studies have found that definitely HRT in most women is going to help ward off an increased incidence of dementia, which does happen if you have a premature menopause. If you have severe symptoms during the time of menopause, that is the time to start HRT if you're going to have it. But if you wait 5 or more years after menopause, don't start it because your brain then downregulates estrogen receptors and the estrogen is like a hormone with nowhere to go anymore and it may increase your risk of dementia. So timing is critical. Individual response and individual needs and individual risk factors are critical to discuss with your doctor.
Yeah, early diagnosis too, clearly. Helena, great to chat to you. Thanks so much for bringing your insights this morning.
We've got to give people a tip though to leave. One of the most important things is to cultivate a positive attitude towards ageing because our beliefs about ageing influence our biology. And there was a study that found that 70% of people who thought that, everything declines with age suffered a heart attack or stroke like 30 to 40 years later, whereas those who were positive about ageing, focused on what they gained rather than lost, only 15% of them had a serious cardiovascular event. That is a 55% difference purely according to our beliefs and attitude. If it was a drug, we'd all be taking it.
Mindset, so crucial.
Think bolder, not older. Welderly, not elderly.
Love it. Good on you, Helena. Great advice. See you soon.
All right, still to come, a severe weather warning for parts of South Australia. I know you guys have already been lashed around already. Rain, hail and thunderstorms to pummel the state. Looks okay there, but Sydney, you're not in the clear either.
Ooh,
it was gloomy overnight and stormy.